Hi, welcome back to Meet Your Body. I am so excited about today's episode. We are talking about one of my very favorite things, which is red light. And it happens to also be something that is trending everywhere right now. And I've been talking to you guys about it for a couple years. I've actually been aware of it for 25 years because we have known about red light and used red light in various modalities in physical therapy. I've been a physical therapist for a long time, so we've used it there, but it's really just come into my life personally in the last 2 years, and I have been touting its benefits since then. So I am so excited. I realized I have not given you a full podcast about red light yet. So that is what I'm here to do. We are going to talk about what red light is. We're going to talk about the benefits of red light, how you can use it at home, who might be appropriate for it, all of those things. And I want you to stay tuned in to hear all the details, but also I'm going to tell you now, just in case you missed the end of the episode, the red light that I specifically use at home, which I will tell you about by Bone Charge, they are having a sale right now. If you're listening to it in real time, if you're listening to this in real time, they are having a sale throughout July 2025 for 25% off. And I'm going to have those links below. You'll need to use my links below to get that sale. So I'll have my links below for that. And it's 25% off your entire order if you decide it's something that you want to incorporate into your own life. If you're not listening to this in real time, no worries. I still have a discount code for you. You can get 15% off with my code Jessica Pilates. And again, that's on your entire order. So I'll have all those links below, and you can always reach out and ask me specific questions if you have them. There are many different red light devices out there, and we're going to talk today about how you can choose the best one. But I can tell you right now that for the past 2 years, I have used only Bone Charge. I am thrilled with the products that I have. I am thrilled with them as a company. I am more than happy to pass on the savings to you and to be an affiliate for them because I absolutely adore what they offer. So let's dive in though to red light and what it is, because you might just be asking yourself right now, what are you even talking about, Jessica? All right, so red light is a modality that you can use in healing. So in physical therapy, for example, we have used red light specifically for wound healing and for inflammation, but specifically for wound healing in the past. So we've known its benefits for skin. And let me tell you how it works. And I should back up a little because when you hear red light, you might think, well, what does it feel like? What is it? I'm going to get into the science and the details of it. But it is literally what it sounds like. It is a device, and I have one here. I'm going to show you in a little bit. So if you are watching this on our YouTube podcast channel, you can see what I'm holding up. I am holding up a unit that's probably 2 inches by 6 inches by like 1 inch deep. All right. And it has these lights on it. So this is just handheld and has these lights. I don't have it turned on yet, but when I turn it on, you will see it literally just emits red light. Okay. So that's what it is. And there are 2 different types of red light. So there's infrared and then there's near infrared. And the difference is the wavelengths that they produce and how deep that they penetrate the skin. But for you right now, knowing it's just one you're going to see with the naked eye and one you won't. And so there are times you might use red light where, believe it or not, you don't actually see the red light. But what it is it's literally light, all right, that you either see with the naked eye or you don't, that's emitted from a device. And the science behind it, what red light does is it works on the mitochondria, which is the powerhouse of your cell. So every single cell, and you might even remember this from like 8th grade biology, but mitochondria is the powerhouse of the cell. And red light specifically works on that to help increase energy production. Now, what's really cool about that is your entire body is made up of cells. And so there are many different benefits of red light that we'll go through, but you can kind of think of it as the red light is going to help that cell to work optimally for what it's made to do, right? So if it's a skin cell, if it's a cell in your muscles, if it's a cell in your joints, like think of it really simplistically that way, that we have found that red light, by working on the mitochondria, by working on that cellular level to help increase the energy production, it helps that cell work optimally, which then helps the function of that cell overall. So that's what red light does. It is not anything that you feel. So I like to start off with that too, because I find for myself, unless I can really visualize what this treatment feels like or looks like, it's hard for me to even grasp what the benefits are. You will not feel this for the most part. Now, there are times that you might feel a very, very light, gentle warming when you're using this, but I mean very gentle. Otherwise, you are not going to feel anything whatsoever. It is an amazingly simple treatment and technique to use. It is non-invasive. You will not feel much at all when it comes to the treatment time itself. When it comes to the benefits, you are going to see and feel quite a bit, in my opinion, and at least that has been my experience. So you kind of know, I told you a little bit about how the red light works. And in some ways, the research that has been done around this, especially decades and decades ago, which, believe it or not, NASA helped lead the way in the research around red light and light in general. You can go back and just think of the benefits of light. And a lot of ways we go back to that when we think about what red light is doing for us. Just think about light in general. We know we literally need it to survive. Walking out into the sunlight, even without sunglasses for 15 minutes a day, is vital. Like walking out into the sunlight without sunscreen on for 10 to 15 minutes a day for a short amount of time. I want you to wear your sunscreen. But we know from some research that just going out without the sunglasses, without sunscreen for a very short amount of time into this direct sunlight has so many benefits when it comes to vitamin D and when it comes to mood and helping your circadian rhythm so that you sleep better at night. Light is a very, very powerful source of healing for us as humans. And so we kind of knew that. Research has been around light in general. And then we started looking into red light. So knowing those benefits of what it does to your cells on that cellular level, I'm going to go through some of the really specific benefits that we have found. And again, through research. So there have been research studies done. And then there's also been, in addition to research studies, quite a few subjective case studies done. And we're talking by really big research institutions through Harvard, through NASA, through dermatologist associations, through many big groups, looking at the benefits of red light. So a few things. One is skin. If you've heard about anything kind of through the mainstream, it's probably around skin. So it has been shown to help. And again, think about what it's doing to the cells, right? It's increasing energy. It's increasing the way that those cells can work optimally, which means it is helping with collagen production. It's helping with elasticity of the skin. It can help with wrinkles. It can help with sunspots. That's why you see red light masks all over the place, which, yes, I have here actually, and I use it and I have seen the benefits from it. And I'm going to have a link for that below because I do really like the red mask or the red light mask. And again, yes, that is aesthetics, but it is more than that because in addition to those skin changes that I just mentioned, we use it for wound healing. It has extreme benefits when it comes to wound healing. And I'm going to tell you my personal story with that. So how did I get into red light before I go into the rest of these benefits? This was, I think, 3 winters ago now, and I live in Denver, okay? We get a lot of sun, luckily, but it tends to get cold, right? And I lived in Hawaii for a long time, so I'm still kind of wanting to get back to that warmth. I was having a tough winter. It was very cold, very icy. I wasn't outside very much. I wasn't skiing yet. It was just a tough winter for me. My office was in the basement of our previous house, and I had one teeny window. So I would be in my office all day long. And I literally, my husband would take the kids to school. I would go straight down to my office. I would work in kind of a cold, dark environment all day. I'd go out to pick, and then I'd work out at home in the same place. And then I'd go out to pick the kids and come back. I just wasn't outside much. And I really felt it mentally. So I felt that seasonal affective disorder. And that winter, I told myself, I am going to do something to help with this. And I read about the benefits of red light for seasonal affective disorder. It made sense to me. I can't be out in the sunlight all day, but I bet I could sit in front of a red light device. So I dedicated myself. I said, next winter, I'm going to buy a red light device. I'm going to look into them and purchase one. And lo and behold, that summer between those 2 winters, Bone Charge reached out to me, the company, and said, we would love to get your opinion on our red light devices, explain the company to me. And they just offered to send me one to try out. No commitment, just try it out and see and get my opinion. And I said, absolutely. I planned on purchasing one for myself. This is absolute serendipity. I would love to have it. So they sent me one, and it was, again, if you're watching this in real time, if you're watching this on our YouTube channel, you see the handheld device I have. So the one they sent me is the Red Light Max device, and that's the one I have set up permanently in a bedroom in our house that I sit in front of. So it's bigger. It's maybe 3 feet tall, and I have it leaning against a wall. All right, so it's like a panel, like a very skinny, tall panel. So I set up in my office, but it was summer. I was outside all the time. I didn't think about it. I said, I'm going to use it in the winter. And then some of you might remember in October of 2023, I was out on a trail run and I was attacked and bitten by a dog and had to go to the hospital. It was an extreme wound. They couldn't stitch it up because of how deep it was, and that would promote infection. So I quite literally had an open, bleeding, healing wound on my leg for 6 weeks that I had gauze on and was getting checked on. And it hit me, well, I know what helps with wound healing. Red light helps with wound healing. And I have a red light therapy device right here in my office. And so I started laying down in front of it with my wound facing the red light for 10 minutes at a time, a few times a week. And I was actually shocked by not only what I felt was improved healing, but actually the relaxation that I achieved from just laying there in front of it. And sometimes, yes, it's simply the fact that I was making myself lay down, relax with the red light. You don't want to look right at it. So I couldn't read my phone or anything. So I would just lay there with my eyes closed. And it really did promote this true sense of relaxation and healing. So I was like, gosh, I think I'm sold on this. And I didn't even expect to be using it for that. Then 2 months later, I was diagnosed with breast cancer. And 4 weeks after that, I had a double mastectomy. And I truly, truly, truly believe the red light was a vital part to my healing. I sat in front of it daily, 10 minutes at a time. I sat in front with my shirt off, working on my scars, doing my lymphatic massage, doing all this self-healing that I needed to do, that I would have been doing anyway. I would have been sitting on the floor. I would have been laying in bed. I would have been doing it anyway. But I had the red light and I said, you know what? I'm going to sit in front of this. I know now the benefits. I have major, major scars that need some work, not only for healing, but also for appearance. I have courting I'm dealing with. I'm dealing with a lot of stress and sadness, and I can't think of a better place to give myself 10 minutes of self-care than in front of the red light device. And I just can't emphasize enough for me. I know this is a very personal story. I can't emphasize enough the value that it held for me during those times. And it became an absolute non-negotiable for me and my own healing. Because if you know more details of my health history, I have endometriosis, I have chronic pain with that and chronic muscle and joint pain. And I'm always working on ways to help my inflammation. And so I just knew I was benefiting myself in so many different ways. And so for me personally, I've said this before, I have like my pillars of taking care of myself that are kind of non-negotiables for me. So exercise and movement, and that changes depending on what my body needs, right? It could be my regular workouts. It could be walking out in the sun. It could be movement when I'm recovering from a mastectomy and need to do my rehab. So movement and exercise is a pillar. Stress relief is a pillar, especially now. I mean, I went through burnout and chronic stress, and I know that taking care of my stress levels and nervous system is a pillar. Walking getting out in the sun is a pillar, and then like nutrition and those kind of things. So those are the pillars of my health. And then fun with my family and those things, those fall under nervous system. Okay. And all of those things too, I truly believe, I know there are expenses involved, and I know we want to commit to our health, but also that's not possible for all of us. So to me, those pillars fit into things that I can offer to you and myself that don't cost a lot of money or don't cost any money. My home workouts, again, trying to get my sleep, walking out in the sun, hugging my kids, like those things, those pillars are what hold up my health and my self-care. Then I have a couple ancillary things that have come in over the years that I've tried and let go of, right? That I've just tried and said, oh, that served me in that period of time, and let go of. Acupuncture is one of those. That was vital to me during my IVF and my reproductive journey. And absolutely, it became a pillar during that time. And then I didn't need it quite as much. I still believe in it wholeheartedly. I just didn't need it quite as much. So that's an example of that. And then there are other trends that I have tried and said, no, that doesn't work. I don't need that. And it just fell to the wayside. So that's what I mean by pillars. And then the things that have come in, those ancillary things that have come in that absolutely have become like just that foundation piece to what I think helps me. And red light is one of those, like truly. And so that's my journey with it. So I'm going to go back to the benefits, but I really wanted to cover, since I fall into kind of that wound healing, that's actually how I got into it, believe it or not. But it has shown so many other benefits for me. So let's continue going with the benefits. So we talked about skin, wound healing, hair growth. So it's another kind of similar way that it works on those hair follicles, growing hair. There are a lot of research studies out there around that and how it can help with hair growth. And that's another reason, I mean, truly during this journey in the past 2 years, I've hit through perimenopause, I've found thinning hair. It's just another benefit for me. I'm going to sit in front of that red light anyway. So by all means, please help my thinning hair. I will take it. Pain. So it's been shown to help with pain, especially kind of that chronic pain, and help with decreased inflammation. So that's been a really important part for me as well. And my goals using it is just that chronic pain kind of idea. Decreased stress. And so again, I think it's both. Like there are definite papers out there that talk about how it relates directly to stress. And then I also find, as I said, it is amazingly relaxing to me. And it might be that it's making me sit for 10 minutes without my phone and those kind of things. But to be honest, I've never been that person that can just sit and meditate for 10 minutes. I mean, truly, that's hard for me. I know the importance of it, but it's hard for me in my monkey mind that's all over the place. But somehow the red light truly does put me into a deeper state of relaxation and being able to rest. And it really does, truly. There are interesting papers right now showing benefits with Alzheimer's and Parkinson's disease. So I wanted to throw that out there, and with depression. And then I want to tell you some really interesting things that I've read about this week when it comes to red light and pelvic floor health. So 2 different aspects of this. One, and yes, I have done this myself. I mean, most of the time, I'm going to tell you guys things about either that I've tried or that I have worked with clients on. I'm not just going to throw things out to you that I don't know about or that I haven't tried. So yeah, I've tried this. I've talked to you about vaginal estrogen, right? And my history with it. And if you haven't listened to that podcast, no big deal. You can go back and find it. It's my experience with HRT. But about 6 months ago, as a part of perimenopause, I started noticing some decreased elasticity, decreased lubrication in vaginal tissues. For me, it came up as a lot of itching, especially with running, like a lot of chafing. And so before moving on to vaginal estrogen, I used red light. I kid you not. I laid down red light on those tissues. I just did it intuitively, okay? Because I believe in red light and I knew what was going on. And then I started reading this week about its uses and benefits for that exact thing. Like it was just one of those things that bolstered what I intuitively already knew, that because of what we know about red light and how it can help with everything I mentioned to you already about collagen production, elasticity, helping the cells, that it is being shown to help with those tissues in the vulva, vulvodynia, dryness in the vaginal tissues. It can really help during that time, not to mention also postpartum. Okay. If you have torn, if you have pain, swelling, if you have stitches, if you have a wound you're trying to heal, it has been shown to help with that as well. And then one other really unique use, I just want to throw it out there. I have not used it myself because I literally found out about this 3 days ago. There are some uses now, and I was listening to some pelvic floor physical therapists. All right, this is where this came from. They helped develop a red light wand for internal use for pelvic floor musculature. And I just want to throw it out there because my goal is to learn more about it. But yeah, I thought that was fascinating. And it just shows you the wide use of red light right now. Now, I want to make sure that you are not getting off this podcast and just going online and finding the first device you find. Okay. If you have to stop this podcast and go do something else, make sure you come back and listen to the rest, because not all devices are created equally. And we're going to talk about that. But those are some of the potential benefits and the benefits that I have seen personally with red light. Okay. And again, while it might seem like a fad, it's actually been around for a really long time, which I find a lot of fads are that way, or a lot of trends. I shouldn't say fads. That's really a bad word to use. A fad might be the whole drinking apple cider vinegar, right? Like that comes and it goes, and those kind of things that you see all over social media. This more seems like a trend right now, but it actually has been around for a long time in healthcare, and the benefits have been shown. So those are the potential benefits when it comes to what it does for your body. But I also want to mention the benefits overall. It's non-invasive. So you're not putting anything in your body. You're not even touching your body with it. So completely non-invasive. It's also not painful, as I mentioned, and it's appropriate for multiple health conditions. I mean, there are probably very few clients or people I can think of who wouldn't experience some benefit from red light. The only downside that has really been found is honestly equipment. And so I think a few burns have been discussed throughout the paperwork, but it always comes back to poor equipment and malfunction. And I feel like that was years and years and years ago when they hadn't perfected it yet. I have not heard or seen anything of that type, but I have seen it again discussed in the papers. And again, it always comes back to poor equipment, not being used correctly, those kind of things. And then the price, I am going to throw that out because it is a downside, and absolutely there's a cost to it. I am never going to come at you ever and say you have to have this one thing for your health. This is the make or break, and it costs this amount of money. I will never say that. Okay. I absolutely 100% believe, and it's one of the tenets of what I do and the company I have, that I want to make health, wellness, empowerment accessible to you, right? Home workouts you can do at home with minimal to no equipment, getting out in the sun, working on your mindset, drinking your water. I mean, all the things, advocating for yourself with your doctor and your insurance, all of those things. So a red light that you do have to invest in, it is just an adjunct. That's why I say it's like ancillary. It's an adjunct to me, to my pillars. It's not going to be one of the main pillars. And I wouldn't tell you that as well. This is going to be an adjunct. And for me, it has really helped tip the scales in certain times of my life. But I'm not going to put all my eggs in that basket, and I'm not going to tell you to do it either. I do believe that it can be a really, really helpful resource in healing if it is something that's accessible to you from a financial standpoint. And also, who do I think might benefit the most? I believe things like chronic pain. So chronic conditions, I think, could really, really benefit. There's some interesting thoughts out there around fibromyalgia, chronic pain. So for me, again, endometriosis, but also my hypermobility that causes chronic pain, because it's giving me, especially that bigger device that I sit in front of, it's giving me global work. Like that red light is hitting my entire body. So it's working globally. Also, let's go more on a micro level. If you really, really are working on your skin, right? If you have wrinkles or scarring or sunspots or anything on your face that is just your main concern, then the red light mask would be a really great option. If you have something smaller, so I'm going to give you some examples. This handheld device that I keep bringing up, I'm going to have a link to this one below. This would be one of the more affordable options. It is a great entry level into red light, and it emits enough that you absolutely could sit with it in front of your face. But what we have been using it on this handheld is a couple different things. One, my husband has tinnitus, so he has ringing in his ears. And if you experience it, it's a really tough one. It invades your sleep, it affects sleep and hearing and so many things. And so I decided to look up some benefits and some possible relationships between red light and tinnitus, and there are some. And so we got the handheld device, and literally he will sit and he can read or watch TV with the red light held right up to his ear for 5 to 10 minutes. I also use it. If you're watching this, you can see I have this horrible burn on my arm from making sourdough the other day, and I burnt it on the 500-degree oven. It's been a week and it's still healing. So I've been using the handheld one under a blanket while we're watching TV with the kids at night, so they don't have to see it. And I just hold it against the wound to help with wound healing and scarring. So the handheld one I think is really nice for that. If you have, in physical therapy, I would use it for total knee replacements. I would end my treatment with 10 minutes of this right on the knee to help with the scar, help with swelling, helping with inflammation. So I do think, like I said, there are different applications for different conditions, and those are how I would see and how they would work. Okay. So how to use this? So if you decide, yeah, I think I'm interested in it, how do I actually use it? I think the sweet spot is 5 times a week. And really most places would recommend anywhere from 3 to 7. I find that I don't usually commit to 7 times a week. Something will always come up on a couple extra days. 3 times a week is definitely better than nothing. But when I was going through my mastectomy and really was focused on that healing and seeing results, 5 times a week is where I felt like I had the best benefit. But 3 times a week has been shown to still be helpful. For 10 minutes, you don't need more than 10 minutes. 10 minutes at a time, 3 to 5 times a week. And you may see really great benefits like I have, but that's kind of the sweet spot. So this isn't going to take a lot of time. And then also another way how to use, I always like to throw it out there. If you're using the larger device, you are not going to be reading or anything like that with it on. Okay. It is bright. You do not want to be looking at the red light. Most devices actually come with a pair of dark glasses, protective glasses that you'll put on. I find I don't need those, but I close my eyes and sometimes even put on sunglasses. With the handheld one, I don't find I need that because it's not shining right at my face. And so again, I can put it under a blanket or something like that. But I will say, I have to throw it out there. I see so many advertisements or influencers trying to use or show their use of red light, and they have it on their desk facing their face while they're working. I'm just going to tell you, honestly, I don't know if you could do that. Maybe if you have a really low one, or I'm going to show you there's some, like I told you, you don't see with the naked eye, that would be fine. But if this red light is shining, you don't want to be looking right at it. I'm just letting you know that. Okay. So if you're planning your use, you either need to have eyes closed if it's shining red light, or have it behind you, or have it, like I said, under a blanket. Or with my husband, when he shines it right at his ear like this, it doesn't get to his eyes. He's fine. And the red light mask is amazing. It has specific eye holes that protect your eyes. So you can work with the red light mask on. I do. I'm always going to give you the real information. That's real information. I just want you to be prepared if you decide to go forward with these things. And then the red mask I'll use anytime. Sometimes I'll come up first thing in the morning and put it on. I do it before makeup. Okay. So I do it before makeup, is what I would recommend. The red light, either one, I'll use it in the morning sometimes if I am using it to wake up my day, or if I'm feeling tight and I need to sit and kind of calm my mind. I also love to use it at night before bed, so it can be used any time of day. But those are the ones that I really, like I said, prefer. The Red Light Max by Bone Charge, the handheld one, I found a lot of uses for that, and then the Red Light Mask. And there are other devices too. If you go to their website, you'll see, just like I said, use the links below so you get your discount for that. And then if you're watching this, I am going to show you just really quick what it looks like. So there's just 3 buttons on the top. And if I click the near infrared light, you'll see nothing. Like there's a teeny, it just shows you that it's on. So it is on and it's emitting near infrared light, but nothing comes out of it. This is what I mean, that you could definitely have this in front of you and it wouldn't affect your eyes whatsoever. But if I turn on regular, there it is. Do you see it coming out? So that's what I mean. You're not going to shine that right in your face with open eyes. And then the difference between the two is simply the depth that they go. So one of them is going to go to skin level, and the other one is going to go a little bit deeper to your muscles and your tissues and your joints. And most devices, the devices I find I enjoy and the ones that Bone Charge make, you can do them both at the same time. And that's what I do. I just tend to do both at the same time. So I'm getting those skin benefits on the surface and the deeper benefits as well. Okay, that covers my love of red light as well as the benefits. So you have both. You're going to make the choice that is absolutely right for you, but at least now you know the science behind it. You know some personal stories behind it. You can decide if it's best for you or not. And you can just peruse and see when it comes to choosing a device. So one of the reasons, there's many reasons I love Bone Charge, honestly. But one, they have submitted to FDA. So they are registered with the FDA. So just know the FDA does not give out approval for red light devices, but you can register with the FDA. And so you want to look to make sure whatever company that you are working with has registered with the FDA. Their devices are registered with the FDA. All right. So that's one thing to look for. 2, look for the wavelength. So you want the wavelengths offered to be between 630 up to 850 or 900. Okay, that's the wavelength that you're looking for. Anything less isn't going to give you a lot of benefit. So make sure you're looking for that. And then just make sure you're looking for a reputable seller. I would look for someone who's done their own third-party studies, who specializes in red light. Like I want to know that they are manufacturing red light and specializing in red light. It is really easy right now because it is such a trend to go and find the cheapest and lowest price, but it's probably not going to do much for you. So just look into it and just, take your time. Take your time. Find someone you trust. Find a reputable seller. Find someone who says that they're registered with the FDA, and then make sure that those wavelengths are appropriate for use so that you will get the benefit from it. So like I said, I'm going to have all the details below. I'll have my coupon code below. Take advantage of the sale now. If you're listening to this in real time, July 2025, you can get 25% off your entire order. And if you're not listening to this in real time, no worries, no big deal. Just wait until you're ready, okay? Wait till you're ready. You can use code Jessica Pilates for 15% off. And then also I'm going to have a sign up for my email list below. I send weekly emails with tons of resources and workouts, and I will always let you know when they have more sales. So you can always jump on that as well. Okay. Thanks for being here today. Thanks for listening to me talk about red light, and I will talk to you soon.